Let's take a look at Angelina Jolie and see how she's managed to maintain her exquisite looks over the years. We will discuss the cost of some of these potential procedures at the end. In 1991, at the age of 16, what I'm seeing is that Angelina has a rounded hairline. She has beautiful brow aesthetics. The medial and the lateral elements of her brow are at the same horizontal height. She has a boxy nasal tip and very full lips, which we of course know her for. She has a broad jawline and a characteristic mole on the right forehead above her eyebrow. In 1992, at the age of 17, you can notice here that her lower lip is about twice as full as the upper lip, and this proportion will later change, so keep track of that. In 1993, at the age of 18, she has this pillowy appearance of just natural youthfulness, with plenty of natural fat throughout her face. That, of course, changes as we get older. In 1994, at the age of 19, Angelina has this very nice wide smile with full exposure of her upper teeth. In 1996, at the age of 21, you can see that she has this thinner eyebrow appearance, and this is likely due to some plucking. She has great supratarsal show right above her upper eyelid margin. She has significant upper tooth show on repose. Both the central and the lateral incisors are visible when she just opens up her mouth. She has a very nice short philtrum, well defined, and the cupid's bow is also well defined. She has strong cheekbone structure, and the chin is, of course, prominent and strong as well. In 1997, at the age of 22, you can see a return of some of her eyebrow fullness, both in the head and the body of the brow. She has upper lip fullness that is more significant than what she's had prior. And she has actually admitted to getting lip silicone injections in the past. So perhaps this is around the time when she's had that done. In 1998, I'm not seeing any changes. 1999, what you can see is when you look at her nose, both in this photo here on the right compared to how she looked at 17, I'm not seeing any obvious signs of a rhinoplasty. Others have commented on this and have thought that, early on she had a rhinoplasty, but you can see that depending on lighting and the way the makeup is done, it can be quite deceptive, especially for analyzing the nose. But at least at this stage, I'm not seeing any signs of a rhinoplasty. In the year 2000, at the age of 25, what I'm seeing is that Angelina has a nose tip that starts to look a little bit more narrow, a bit more defined. So I don't think she's had the rhinoplasty when she was younger. Maybe around this time, around age 24, 25 is when she had her rhinoplasty to improve to some degree some definition to the nasal tip, but it really wasn't a major change. It wasn't a big overhaul. It was just a subtle improvement to the nasal tip, if anything at all. In 2001, at the age of 26, you can see that Angelina has some under eye hollowing on the left that's more pronounced than on the right. And this is the same type of discrepancy as when she was 16. We all have facial asymmetries, and sometimes one side under the eye can be a bit more hollowed out than the other side. I'm not seeing any actual other procedures really being clear to me here. In 2002, at the age of 27, no further changes. You can see here that her right eyebrow sits higher than her left, and when she has the dark makeup on there, it makes it even more obvious. In 2003, at the age of 28, the left lateral brow is starting to descend to a degree compared to her photos from prior, and the reason this is happening is because you have the temporal line, and lateral to the temporal line, which is a fairly thick structure, the brow isn't well supported, and so the lateral brow tends to descend as we age, much more than anything more medial to the temporal line. In 2004, no signs of changes, same in 2005. In 2006, at the age of 31, is around the time of the birth of her first child. The photo here is a great example of how photography can really distort, especially photography that has been further edited. It can distort your normal anatomy. And so you can see how the nose in this image appears much more narrow, but this really doesn't hold up in future images. So with the ability of makeup to contour the nose, the way the photographs are taken and also sometimes re-edited can really alter one's appearance. In 2007, at the age of 32, there are no further changes. 2008, she is pregnant at this time, no further changes seen. 2009, you can see that she has rhytids, which are wrinkles, visible on her forehead and starting to be visible in the under eye area. There are no obvious signs of Botox that I can see at this stage. 2010, age 35, no further changes, same in 2011. In 2012, she's sporting fuller eyebrows, which I think really looks great on her. And you can see that there has been a reduction of lateral cheek bone volume. It's just something that happens over the age of 25. The overall bone density goes down in men and women. And so, that's just what's happening to Angelina. She's not immune to that. And so the lateral bone volume goes down and the facial appearance is going to change. And it's always tempting to think that, they've had more procedures and cheek implants and other things that might give you this look, but there's also an aging process that is going on. 2013, at the age of 38, I'm starting to see some signs of Botox being used to the forehead, glabella, crow's feet. You can see a smoothing out of those areas. Also notice slight changes to the hairline corners here. The frontotemporal angles are starting to basically recede a little bit. There's a bit of basically standard typical hair loss that's occurring in that area over time, which is very minimal in her case. Please make sure to subscribe to this channel and turn on all notifications. We post videos regularly Wednesdays and Sundays at noon. In 2014, at the age of 39, I'm not seeing any further changes. Same in 2015 and 2016. In 2017, at the age of 42, there are some signs of facial drooping starting to occur, sagging and ptosis of the face that's visible in her lower face, not quite jowling, but starting to see that there is that descent. In 2018, at the age of 43, no further changes. However, in 2019, age 44, I think Angelina may have had an upper blepharoplasty around this time. There's an increase in the supratarsal show and a more hollowed upper eyelid appearance that can occur with upper blepharoplasty. In 2020, at the age of 45, most of the pictures around this year were, of course, with a mask on, and it's hard to, of course, see what changes have occurred, but it's also a great opportunity to have had facial plastic surgery. So we'll see in the next 2 years if maybe there's some signs of some work that was done around this year. In 2021, at the age of 46, I'm seeing some signs of cheek filler being introduced. You can see medially and laterally there's quite a bit of fullness that has been added to that area, and I think most likely that has to do with filler, most likely hyaluronic acid based filler that was introduced. In 2022, at the age of 47, I am seeing signs of a facelift. And this may have been a deep plane, it may have been a SMAS type facelift, not sure. But when you compare her left tragal contour back to the image from 1998, you can see that it has completely changed in its quality. Right in front of the tragus there naturally is a little bit of a drop off. And what I'm seeing in this image, looking at her left tragus in 2022, that drop off has been lost and really it looks like the skin has been draped over that area. And overall, obviously, there was great work that was done. I mean, she looks rejuvenated. She doesn't look stretched out. Really nice healing has occurred, but it does to me look like a sign of a facelift. The other element that I can see here is that she has loss of her sideburn hairs. So you can see in this, again, image in 1998, there are those fine little hairs, villus type hairs on the sideburn area that are coming down from the temple. And in 2022, those little hairs have mostly been lost. I don't think that occurred naturally. I think most likely they were removed as part of the facelift procedure, which is fairly standard for facelift surgery. The total cost of these possible procedures that Angelina may have had is $180,000. Since you like this video on Angelina Jolie, We know you'll love our video on Scarlett Johansson.